Mchugh. And remember to turn off to mute your crowdcast audio. It takes a second. I don't think we're quite connected yet. All right, and I think we're in. All right, everyone, I think we're in. Happy Thursday, everyone. Oh, let's get Carla in. Happy Thursday, everyone, and thank you for joining us. For those of you who don't know, I'm Emilia Martin. I founded Data Science Connect. We're the largest data science organization in the Southeastern United States. And today I'm excited to report that we have viewers also from around the world. So sending a warm welcome to all of you joining us from a lot of different time zones, including one of our very own speakers, Terry Singh from the Netherlands. It's about 11 p.m. there. So good evening, Terry.
Good evening, Emilia.
Today marks the beginning of our virtual event series, which will occur every other week on a Thursday from 5 to 6:30 p.m. Eastern Standard Time. Our next 3 events are already scheduled as well, with supply chain and manufacturing analytics on May 28th, which is 2 Thursdays from today. We'll then focus on the sharing economy on June 11th, and then people analytics and HR analytics on June 25th. With everything going on right now, beginning our series with COVID-19 analytics, felt like a no-brainer. And we have a stellar lineup with speakers doing some really groundbreaking work in the fight against COVID-19, discussing topics ranging from NLP, electronic health records, to crowdsourcing data science and developing top-ranking Kaggle models. Thank you to the incredible speakers we are about to hear from for sharing your wisdom and expertise with us today. We also want to thank the University of Virginia School of Data Science for supporting us in this partnership. And finally, a big thank you to our presenting sponsors, Amazon Web Services and Vertica, for supporting and believing in what we are doing. We are proud and honored that today's program is presented by you. Let's do a virtual round of applause for AWS and Vertica. I know, we'll get through this. So AWS will now join us to say hello, followed by our other presenting sponsor, Vertica. First, we'll introduce Patrick Mchugh, a good friend of Data Science Connects and a good friend of, or familiar to the global data science community. Patrick, let me get you live. All right, Patrick, it's all you.
Great. Good evening. Good afternoon, everyone. Thank you, Emilia, and the Data Science Connect community for joining us. I'm Patrick with AWS. We're proud to be sponsoring this series, especially tonight, given the importance of this topic. As we know, this is a worldwide fight and worldwide challenge. And in fact, we have people from the Netherlands and everywhere else with us. So thank you for that. Now more than ever, companies need insight. We need to understand what's happening with the customers, with the businesses in the world faster than ever. Companies need to understand that from diverse perspectives that just a few years ago were hard to comprehend at scale. Data sources that we couldn't think of analyzing at scale, images, sounds, different data types, different documents, and how do we make sense of them at scale? Ever since 2006, AWS has been helping companies experiment and innovate faster. AWS and cloud computing enables data scientists to experiment boldly with a bigger data lab of data and algorithms than was ever before. We enable bold experimentation. Try, Doesn't work, try again. The cost of experimentation is plummeted, which allows innovation to happen faster. Today, AWS is proud to present this impressive panel of experts who are leading the global fight against COVID-19. Many companies, governmental agencies, and universities are partnering with AWS to power their research and insights with tools such as the global COVID-19 data lake. We will share several case studies in the post-event blast. Finally, thank you for our speakers. This is a very impressive list across academia, across World Health Organizations and others. Thank you. We can't wait to hear from you. And thank you for all your effort in this fight against COVID-19.
Thank you, Patrick. I think I can speak for everyone in saying that we all want to know where you got your hat as well.
It's a thing, isn't it? It's a thing, Emilia. It's a thing. This is what we do, right?
Yes. Carla, we're going to bring you up next. Carla Cornish is from Vertica, our other presenting sponsor, who is making today happen and the next several events as well. So Carla is going to say a couple words about, more than a couple of words about Vertica's influence in the data science community and on the COVID-19 analytics panel that we have tonight.
Hi, thank you so much for allowing us to participate and to be a sponsor. Can you hear me okay?
I'm going to mute everyone really quickly, except for you. So let's see.
There we go. I think I just unmuted myself. Can you hear me?
Perfect.
Awesome. Thank you so much. We're excited to be a sponsor for this event. I thought, it's such a timely thing, and so just important for all of us as a community to kind of rally together, right? And I don't think until things like this actually hit that we really fully realize the impact that COVID, that data science has in so many ways that affect our day-to-day business that people don't even realize. And so, we just wanted to, as a Vertica, we're proud to be a sponsor for this event. A lot of people may not know the Vertica name, although you've probably interacted with us and had no idea that we were there. So Vertica has been trusted by thousands of leading data-driven enterprises around the world, including companies like AT&T and Etsy and Twitter and Intuit and Uber, to deliver speed and scale and reliability when you have mission critical analytics. So that's kind of where we excel. And so when we have times like this, we work with people in healthcare organizations, and people are using Vertica in the background, right, to run analytics and talk about what's happening with all the information that's coming in, especially when it's changing on a daily basis. People are getting massively digesting massive amounts of petabytes of data that's coming in at a time, especially when you've got pandemic situations like this during a time with COVID. And so people are needing to be able to respond and see what's happening and be able to run analytics with great speed and scalability. And that's kind of the sweet spot where Vertica sits. So we're excited to be a partner for this event. I look forward to the future events and excited to be here. And thanks everyone so much for your support and your participation.
Thank you.
I think I was muted.
Yep.
Turned myself into a YouTube video making fun of our virtual conversations. Thank you, Carla. Thank you, Patrick. Also, Carla, sweet pad. You should send us an invitation sometime.
Yeah, well, that's the only escape I can get. I've actually just done one of those little virtual backgrounds. So that's my mental escape during the day, right? But if only one of these days, we'll get back to that.
We all want to be there.
Yeah.
So a couple more things before we get started. We'll have a Q&A portion at the end for 15 to 20 minutes. If you want to ask a question, please use the Ask a Question feature. I'm going to try to, it's at the bottom right, sort of to the left of the discussion box. I'm going to try to sort of monitor the discussion conversation to move them into the question feature so that folks can upvote. But if you use the Ask a Question feature, your question can be upvoted and has a higher likelihood of getting addressed by our experts. So feel free to use the expert, or feel free to use the ask a question feature. And then for folks who like that question or who want that question to be addressed, use an upvote so that you make sure it's at the top of the list and that we can get to it during our 15 to 20 minutes. Now it's time to hear from our expert panel, who brings a range of backgrounds and perspectives. I want to introduce Karan Uppal, PhD and Director of Computational Systems, Medicine and Metabolomics Lab at Emory University. Karan is here from Atlanta, Georgia. We've got Russ Wolfinger, Director of Scientific Discovery and Genomics at SAS. He's tuning in from Raleigh, North Carolina. We've got Funda Gunesh, a principal machine learning developer at SAS, also joining us from Raleigh, North Carolina. We have Jesselyn Dunn, founder of COVIDENTIFY, and assistant professor of biomedical engineering at Duke University and Duke Clinical Research Institute, joining us from Durham, North Carolina. And then we have Terry Singh joining us from the Netherlands. It's 11 p.m. there for those of you who missed that during the beginning portion of our introduction. Terry is a founding member of FGA 14H at the World Health Organization and a founder of DeepKatha.ai. Finally, we have Afshin Beheshti joining us from Houston, Texas. Houston?
No, well, I live in Boston, but it's Ames, NASA Ames in the Bay Area, Silicon Valley area, Mountain View.
Okay. And he's a bioinformatician and principal investigator at KBR at NASA Ames Research Center. So everybody ready?
Yeah.
Good. So to kick things off, we're going to start with brief backgrounds on everyone, as well as how and why you're currently using data science in reference to COVID-19 related efforts. And we'll start with Afshin, since I messed up his hometown.
Sure thing. Yeah, no, thank you. Thank you for having me here. So yeah, I'll give you a brief background of who I am. So it's basically how I came to COVID-19 research and Emilia having me on this panel. So my background is actually in physics. So I got a physics PhD, and then a long time ago, I switched over to cancer systems biology, as a lot of physicists do, or people who do data science type work, or computer scientists, they tend to go to systems biology in the biological world. And eventually, I transitioned. It was an assistant professor at Tufts University, and eventually I got a position at KBR NASA Ames facility at Mountain View near the Silicon Valley area. And what I do, there's two things I do at NASA Ames facility. One, I have my own projects and grants that I work on. And another one is I work on a project called Gene Lab, which is a omics kind of platform, a big data platform, basically, for all space biology related research. So people can go there, anyone from the scientific community or a citizen scientist can go there and basically mine publicly available data related to space biology. So you can do that. Within this, we have these analysis working groups, which scientists around the world can come along and assist us with questions we might have for the community, and then also work on various projects with other scientists from around the world. So how this evolved now is that within this group, we had a couple of people working on COVID-19 research at the end of March. And within that, we said, why don't we have our mainly computational biologists and bioinformaticians come together and work together to see if we could use our background. We're not COVID-19 experts, but we have enough knowledge about bioinformatics and how to deal with big data to actually tackle this data and come up with potential targets maybe for drug therapy and so on. So at the end of March, we all got together and we started working on it. And eventually my vision, along with my co-lead of the group, Todd Trigan, we decided we wanted to have this group where we can not only do the big data analysis and bioinformatic work, but also evolve it into have people in our group that are biologists and other clinicians that can actually design a drug target that we possibly come up with. And then people who are like virologists who have access to labs that can actually do the experiments with the inhibitors we come up with. So now we have evolved. Let me quickly share my screen since Emilia said I can do that and show you our website. Now we have 124, 125 members approximately. We call ourselves COVID, COVID International Research Team. Anyone can contact us and join our team. Todd and Krista were basically the founders and co-leads. We have our latest newsroom, we have this highlighted here. And I'll go quickly to the members page, and then I'll get to what the main just the question is. So in our team, as I said, we have people from various academia institutions, as you see here. And if you scroll down, the various expertise from all around the world. I'll keep scrolling down quickly. And then you guys could go here yourself at cov-irt.org, covert.org. You see people from various expertise we have there. And then we have people from government agencies to companies to industry, all involved. And people can join us and participate with our activities and deal with what we're doing. So the big data aspect on how we're dealing with COVID-19 research. What we've evolved in the past 6-7 weeks, which seems a lot longer now since we've been all working at a really fast pace because everyone knows the urgency of having to try to come up with a potential target and the importance of this. And within our group, we have people who are bioinformaticians who have tackled big data. So for example, we have a collaborator with our group, Chris Mason, who's in Cornell Medical College, which maybe a lot of you might have heard of here because he's done a lot of interesting projects like the NASA Twin Study project, which I'm collaborating with him at, and swabbing the New York subways, figuring out the bacterial compositions. He's done a lot of interesting work like that. And so he's done this massive sequencing project where he now has 900 COVID patients positive and negative sequence. And that data is immensely important because now we can mine this data for potential targets. And having the larger and larger data sets out there makes it easier for people to actually come up with targets. And we're not the only group that's doing this. There's tons of groups around the world that's working together. And my goal is to bring people together. For example, we started collaborating with the N3C, which is an NCATS sponsored NIH program. It's called the National COVID Cohort Collaborative, I think. I forget one of the C's I always screw up. And there's also the New York Genome Center, which they do a large sequencing project within the New York and international thing too. So, reaching out to others and collaborating with each other is the only way, open science like this can actually tackle a problem of this magnitude and pandemic that we have. And within this group, as I said, to tackle the big science platform, the key is not only to think outside the box and bring people from multiple disciplines in, and not just virologists, but from every background, because then we can tackle certain aspects of the data differently. And with a large group like this, we could come together and actually do this. So within our group, just briefly, we have already come up with a potential target that we're going to test. And we're testing whether it comes anything out of it or not. We'll find out. But that's the power of having such a large group together and collaborative group together, because whoever comes up with a target, there's people in our group who could design an inhibitor and potentially test it, and then move on to hopefully having contacts to if we come up with something successful for a clinical trial, if that happens. So that's the goal. But minimal factor is the data that we're analyzing as a big data can actually help the entire world, whether we come up with a therapeutic or not. This data is going to help our knowledge for COVID-19. And that's how big data should be used in the sense that we have. And I guess other people here are using also. I think I answered that question, right? Oh, you're on mute.
Yes.
There you go.
Thank you, Afshin. So should we do Terry next? Terry, can you tell us about your background and briefly, and then the COVID-19 related projects that you're working on right now?
Sure. Thank you for having me here, Emilia. I think this is a wonderful opportunity to bring people with diverse backgrounds together. There's a lot of excitement in the industry, as much as there's a lot of uncertainty in our society. with how this is actually challenging all of us. Um, and just to give you a little bit of an introduction of who I am, so I am CEO, a founder, and a researcher. That's who we all are, researchers within our startup at DeepCaf.ai. We've also recently launched a healthcare startup, and probably that is a more interesting link to how I started getting involved with healthcare a couple of years ago, and specifically in molecular biology. And that was just, we were doing a bunch of deep learning projects, all driven around trying to solve this, the ills in our society that we have. For example, breast cancer may not be a huge problem in societies, especially in Western societies like we have here in Europe or in US. But it would surprise you that even young women at the age of 18 or 19 contract breast cancer in Afghanistan. So to me, it was a huge driver. I lost my dad 10 years ago to liver cancer. And since then, I've been kind of very angry. And so that anger also kind of, in a way, came back with this helplessness, a sense of helplessness that we are right now dealing with. So Sakurai, which is Latin for care, we launched this startup just a couple of months ago. We've done a bunch of other projects, but I won't get into that. And one of the steps that we took a couple of months ago, I think 2 months ago, was to how to create this sense of awareness inside the World Health Organization. And this was much before, I think this was probably a couple of weeks before we heard in Wuhan of this outbreak. I was myself traveling to US. I'm a visiting faculty at the university in Dallas. And I think, just before the vacations for students were coming back, we hold, large boot camps in healthcare as well with AI. And so it became a very interesting topic. So in World Health Organization, you have focus groups. That's what you saw. So the FG, it's a long sort of, title that you see. It's basically focus group for AI, focus group AI for health. And we are one of the topic drivers in one pathology. And we have, we just sort of concluded a huge meeting with hundreds of people from all over the world with great skills, trying to bring artificial intelligence or the use of machine learning and deep learning inside the World Health Organization. And having said that, obviously, myself from the industry, and we have a bunch of people that I work with from medical colleges in Europe, and we created this group to bring this awareness inside the World Health Organization. We believe that there's a lot of AI still seen as, even in the healthcare community, I'm sure we experience this on a daily basis, but it is seen as a black box. Doctors are, and surgeons, physicians, pathologists, histopathologists, or virologists in this situation are not used to just subscribing to a diagnosis coming from an algorithm, whether it's medical imaging or using some kind of a natural language processing. So we know it's a long road to help doctors identify and see this as a decision support tool and hopefully a prognostic tool to be able to fight this. What are we doing with COVID? So obviously we jumped onto this, and I'm blessed with this huge network of researchers we have. So right now we have people who actually have had education, have done all PhDs, guys around me. Some guys done a PhD in virology, neurobiology, neuroscientists. We have oncologists, and cell biologists, and all these people are part of my research team. So we started discussing how to understand from a European standpoint, probably if it helps others, And I'm sure I'll go into detail in later when you pose the question. But so what we're doing is obviously identifying COVID or COVID type symptoms or SARS-CoV-2, the coronavirus symptoms, looking at X-rays and CT scans and ultrasound. So there's a lot of things is evolving. We're constantly watching. It almost feels like you're holding on to a slippery rope, and your analysis of 2 weeks ago probably don't make sense anymore. So I can totally understand and empathize. Obviously, I have deep admiration for the work that our healthcare people are doing across the world, dealing with a novel virus. That's what it is, nCoV, how they call the SARS-CoV-2 strain. And I think, so there is, so one of the projects that we are also applying for funding here in Europe, there's a lot of capital available. Unfortunately, people have not been able to see that it takes time to actually do diagnosis. So there's a diagnostic aspect of COVID, and we're working on that and trying to understand using deep learning and some novel AI. I keep using interchangeably, but it's basically deep learning architectures to identify whether it's either binary classification, and obviously segmentation is going to be the most important thing as we progress into the next couple of years, because it's going to be amongst us, unfortunately, for quite a number of years. There's another manufacturing aspect where people are looking at track and trace, contact tracing, and see if you can use all different kinds of wristband and try to figure out how to use technologies with not using contact tracing through Bluetooth, which Apple and Google has worked on. And the third, which is actually something which I really think is going to be important for us, at least in Europe, is, well, I'm beginning to call it since the last couple of days, reuniting our populations. And I'll probably go deeper into that and trying to understand and maybe help the audience understand about the epidemiological models that we are looking at, and how do we want to sort of look at from an epidemiological perspective, and try to use the the standard models, the SEIR and the SEIR, SEIR models, to understand how do we reunite the population. We used to call it herd immunity, which is becoming kind of almost like a bad rap. If you hear the Prime Minister of New Zealand, I know it's great. I'm very happy for people of New Zealand. They're beginning to get out of their homes, but I do warn everybody, please be careful. There's a resurgence. Let's not rejoice too early. This is still a virus we don't understand very well. And trying to sort of, I don't want to get into the preaching mode. I think we are all learning ourselves. So the group immunity, or which I would rather call reuniting populations, which is where we are going to deal significant amount of psychological, behavioral sort of challenges with each other, is going to be something lasting. It's going to be with us for the number of years. How do we reunite populations, meaning the susceptibles, the exposed, the infected, and there, the swimming between these are the symptomatic and asymptomatic. And asymptomatic is becoming a problem, as you may have heard if people are following the news. Wuhan just yesterday, they sort of, something which I've been saying that we should test a lot. They've decided, since there is a resurgence with another, I don't know if you can call it a patient zero, it's a patient not one, where there is a fear of resurgence in Wuhan. So they want to test all 11 million people. So I think, reuniting our population, reuniting ourselves, coming together, is a social imperative that will definitely have a public health implication, anxieties, and a bunch of other things we need to make sure as well. And that is a project we're working on. I'll try to get into a little bit of a detail if it's possible in this chat.
I'm sorry, I don't want to interrupt. I want to make sure we can get through the whole panel discussion, because
Please go ahead.
We're on a limited time frame, and I want to make sure we're not getting ahead of ourselves in terms of everything I want you to contribute during the panel discussion.
Thank you. That was so lots of work in World Health Organization as much as our individual work. So thank you for having me.
Thank you so much for joining. Terry, what time is it right now?
It's 11:30.
Okay,
It's the night is young.
good. Next up, we'll have Jesselyn Dunn. Can you tell us a little bit about what you're working on and a little bit about yourself, and then we'll pull in the last three speakers for brief intros, and then we'll jump right into the panel discussion.
Sure, absolutely. And thanks so much, Emilia, for organizing this. This is fantastic. So I'm Jesselyn Dunn. I'm an assistant professor at Duke in biomedical engineering and biostatistics and bioinformatics. I've been here for a little over a year and a half, and previously was a postdoctoral fellow at Stanford, working with the NIH BD2K program, which is Big Data to Knowledge. And my work is primarily in, broadly biomedical data science, but more specifically in integrating what we call multimodal data. So taking data from electronic health records and data from wearable sensors and multi-omics or biomolecular data and bringing it together to make predictions about health and disease. So I guess to give a little bit of background about how I got into the COVID space, because I think all of us are really new to COVID-19 research. At Stanford, I was doing a lot of work using wearable devices, mainly consumer grade devices. So these are things like your Apple Watch or Fitbit. What we were working on there was understanding how these devices could be used to detect all kinds of chronic and acute diseases. And what became really evident was that infectious disease is actually quite easy to detect from a wearable. There are some obvious signatures that happen. As you can imagine, when we have a fever, when we get sick, we can feel that our body changes. And there are actual signatures of that we can detect from smartwatches. And so with that, we developed this concept called the digital biomarker. And my lab here at Duke is actually leading digital biomarker development in a variety of different avenues. One of our big passions is to open source digital biomarker development. So we have a project going on right now. You can check it out at dbdp.org. It's the Digital Biomarker Discovery Pipeline, where anyone, even citizen scientists, can contribute to working on developing digital biomarkers. So I'll share my screen real quick because I do want to show you what we are working on specifically with respect to COVID-19. Hopefully everyone can see my screen here. And essentially, this is the study that Emilia had mentioned, which is COVIDENTIFY. And anyone can join this study. You can have a smartwatch or not have a smartwatch. We're learning a lot from people who don't have smartwatches as well about symptoms and social distancing habits. And really, the goal of this study is to develop these digital biomarkers based on people's behaviors and based on their physiologic measurements like heart rate and sleep and exercise, how often they actually wear their watches, to try to determine how that relates back to health outcomes, getting COVID-19, getting the flu, and other types of infections. So we're really excited to have the opportunity to collaborate with a variety of other researchers who are tackling COVID-19 from a lot of different methods. This is not a contact tracing study. I want to emphasize that. Really what we're doing is we have daily surveys that are very short, just 2 questions, and we collect the smartwatch or smartphone data. I think that about covers it. I will also very quickly just show this digital biomarker discovery pipeline. So again, you can check either of these projects out at dbdp.org or at covidentify.org. And I know that we're running short on time here, so I'll wrap up my intro and let Emilia move on to our next members here.
Thank you, Jesselyn. And everyone will send information for getting involved in Jesselyn's study in our follow-up email and the event page as well. So you should all get involved with that, whether you have a smartwatch or not. Next up, let's go ahead and pull Karan Uppal to the stage to tell us a little bit about what he's working on.
Sure. Hi, everyone. I'm Karan Uppal. I'm from Emory University. I'm an assistant professor in the Department of Medicine. So I come from a bioinformatics and data science background. Most of my research is focused on identifying metabolomics and multi-omic biomarkers of different diseases and environmental exposures. I've also, part of my PhD work was related to text mining and natural language processing. So extracting information from scientific literature and clinical notes, discharge summaries. So when the whole COVID-19 thing started, so I have to thank my father, my wife, and my friends for getting me involved in COVID-19 research on anything related to COVID-19. So I started doing some research to see what can I do with existing data sources and what sort of data sources are out there. So I figured, well, since I already have some existing algorithms for mining scientific literature, I will start there. So basically, I submitted a grant application to the COVID-19 HPC High Performance Computing Consortium, which was sort of initiated by the White House's Office of Science and Technology Policy and supported by IBM, Microsoft, and Amazon, and other big IT companies. So they gave me this award. So we've now developed this TM COVID. And I'll quickly just share my screen to show you what it looks like. So yeah, so basically it's a web-based interactive app. So it's in real time. It's communicating with PubMed or PubMed Central, where you can access full text scientific literature. So it's essentially a plugin for PubMed. It allows you to get the results you get normally from PubMed, but it does some additional processing on those results, and then it presents you a summarized table of the information in those full text articles or just the abstracts. So specifically, it's tagging or it's trying to identify gene names, chemical names, other diseases and disorder that are co-mentioned with the COVID-19 scientific literature. So we're working on adding other modules to this. So basically, since I'm in the Department of Medicine, some of my colleagues told me that part of the challenge is being able to deal with the amount of information that's being released on a daily basis. There are at least 10 to 20 publications being released in Nature and Science. So it's hard for people to keep up with all this information. So we are adding other modules to this to sort of perform full text automated summarization. So that's one piece. The other piece that I'm working on is in collaboration with the Emory Healthcare IT. So Emory Healthcare, they've seen about 1,400 COVID-19 patients. So the IT folks, they've using Amazon Web Services, they've sort of done, they've processed the clinical data warehouse data, and they've converted into a form where now data scientists like me can come in and start applying these machine learning algorithms to identify patterns in the clinical data and the laboratory data and whatever clinical symptoms they were showing and what were the outcomes. So essentially, these are the two projects that I'm currently working on and looking forward to sharing more details as the session progresses. Thanks.
Thank you, Karan. So let's get to, let's do Funda next, and then we'll wrap up with Russ and then jump into the panel discussion.
Hey, thank you. Thank you, Emilia, for inviting. So how I started and get into this COVID-19 work, let me start with my background. My background is in statistics. I have a PhD from North Carolina State University. I've been with SAS Institute. It's a software company based in Cary for about 10 years. About 5 years ago, I switched my role. I started as a statistician, research statistician. I switched more into machine learning engineer role. And I'm supporting this cloud-enabled in-memory analytics platform, which is called SAS Via. And the application that I am support is called Model Studio. It's a web-based interface for performing end-to-end analytics. And this also includes like how we can automate building machine learning pipelines. So it's really important for us to have a lot of hands-on data analysis and experiences and learn some best practices to really decide how we can build this product. And we have a great deal of collaboration going internally with SAS and other teams too. So when this first outbreak started, like as everybody, it was so uncertain and we were just hearing a lot of different things. It was just hard to believe all. And so I just wanted to get on some hands-on experience. And I've been using Kaggle platform for a long time to download data sets, to learn from experienced Kagglers like Russ, and to follow discussions, but I have never actually been involved in a Kaggle competition before. So I downloaded the data set, I started to run some simple analysis with some simple feature engineering, and then I found out Russ is also looking into same data. And we just started to chat about, what else we could do, what are kind of really good feature engineering, how we could incorporate this time series data into new features, because we follow the fully machine learning approach and use like boosted algorithms and such. So it was a really great learning experience for me from Russ and for the whole Kaggle community, because everything was really open and people were sharing. And we submit our model and we found out that we were in the top 1%. I can tell you more about the competition, how we are evaluated really briefly if you want. So the goal was to predict the cumulative fatality and cumulative confirmed cases over 300 regions in US. And for this, the data by Kaggle provided was really simple. It literally has 6 columns in it, the location and total number of confirmed case and fatality and the date. So we were allowed to bring a lot of external data sources, such as country demographics, like we all know that weather information, age information. Also, we had to really carefully think about how we could incorporate time series data as new features, and came up with a really smart validation scheme and also doing a lot of tuning, hyperparameter tuning for machine learning algorithm and ensembling. It was a great deal of learning. We use a lot of the other solutions by other teams too. Yeah, so we are actually, there were 4 weekly competitions, and the last competition, week 4 competition, ended in April 15. So since April 15, tomorrow will be the last day. Our models are evaluated based on this John Hopkins data. So each day the leaderboard is updated, measuring how we are close to the value based on reported by John Hopkins, and we are still leading #1. But we are getting a little anxious. The difference is getting smaller and smaller. So we'll see what's going to happen tomorrow, which I believe they will announce the winners. Thank you.
Thank you, Funda. Russ, will you wrap us up on the intros, and then we'll jump into, I think we're seeing a lot of the audience questions overlapping with our pre-planned panel discussion topics. So we'll kind of weave in the two and make sure that we address our top voted questions. Be sure to keep voting on those and submitting your questions. And then we'll make sure we cover the topics that we thought were most important for this panel discussion as well. All right, Russ, your turn.
Thanks, Emilia. Hi, everybody. Greetings from Holly Springs, North Carolina. And I'm actually not far from both Funda and Jesselyn. And I've been really fortunate to I've worked at SAS my entire career, 30 years now. Like Funda, I got a PhD in statistics from NC State, and it was really great training there. And then it's just been it's just such a great company to work for over the years. I've spent a lot of time originally writing statistical routines, and then my wife is a molecular biologist, PhD. She's Dean of Math and Science at Meredith College here in Raleigh, Liz, and she got me going into the genomic space around the year 2000, and spent quite a few years doing some code around that in the JUMP division that I work in. We've got products, JUMP Genomics, JUMP Clinical, but my real passion is just working with data, and especially when you write some code and code up with some solid algorithms, it's really satisfying to take that code and then help solve a problem, and even more satisfying to send that out to folks and have them be able to do the same and enable them to do great things. And then, of course, the COVID thing is just a natural fit for this. And for me personally, I got to confess, might be considered a recovering Kaggle-holic. My wife kids me. Fortunately, our kids are grown.
No, you're not a recovering Kaggle-holic.
Yeah, well, I think with COVID, I may have fallen back off the wagon a little bit, but it's a kind of all for a good cause, I think. And certainly it's been a great pleasure teaming up with Funda and working on it. A lot of extra hours, late nights and things, trying to balance with work life things. And so really happy to forecast as Funda was talking about. And there is a week 5 just launched actually today, first leaderboard. And Funda was smart enough to kind of get her life back in balance, but I'm still going. And I ended up teaming with one of the other guys from the previous week. So we're going to do week 5 now.
Thanks, Russ. So on that note, our top rated question right now, and something that I know probably is very relatable to each of our panelists, especially Russ and Funda, as they were literally fighting to, and are still fighting to maintain a top predicted model in terms of outcomes and death rates. Our top rated question right now, which is also weaves into our planned discussion topics, is, as data scientists and researchers scramble to build predictive models for metrics like fatality rates and recovery rates, how are we doing this reliably with a denominator such as number of diagnoses that's continuously changing due to inconsistent and unreliable testing and other variables? Russ, you want to continue with this, and then we'll pass it on to the rest of the panel?
Yeah, sure. This arguably the most critical problem with the data that we're looking at now. And it's very important to keep those denominators in mind constantly. The forecasts we're making from Hopkins are based only on reported number of confirmed cases and reported number of fatalities. And undoubtedly there's a huge amount of underreporting to varying degrees throughout the world. And so we've got to be realistic about, what we're forecasting. And man, it's actually a really difficult problem to try. If you were trying to really estimate the true number of, say, folks infected in a country, that's a pretty difficult one. And I applaud research like Jesselyn's doing. I think that's getting at it, where you can kind of get closer to the folks and try to get some kind of handle on things. Also, all of our panelists, we're trying to attack this from different directions. That's probably a great idea, just to get a feel for it. But you just get, in one sense, you just got to be realistic. You shouldn't overstate what your conclusions are, and be careful about over-interpreting forecasts. Just try to be realistic, and I think we can do that if you're sensible about it.
Russ, I know you also mentioned that you guys used a certain approach. I can't remember which one it was. Was it random tree, or used a certain approach that sort of helped alleviate the holes in the data with the Kaggle competition? Do you remember what that was? Was it?
Yeah, the gradient boosted trees are just they're pretty much for tabular data on Kaggle. You're going to see that they pretty much are in every winning solution I've seen. There's popular open source packages, XGBoost, LightGBM, CatBoost, and then in SAS we've got our own GradBoost that we were working with kind of locally also, and Funda is an expert working with it. So it's been a lot of fun. Those those techniques are really amazing. And then the trick, I think, for predicting COVID well is combining that, which can pick up a lot of local effects, with the classic disease type models based on differential equations. There's no question those dynamics are present. And then the trick is try to optimally blend these into a nice ensemble. That's usually the way to get the best possible predictions.
Thanks, Russ. Who else wants to comment on how they're sort of navigating the sort of the unpredictability and the constantly changing denominator that is diagnoses and death rates and survival rates and testing, and even the A/B testing, if you want to pull that into.
So I'd be glad to jump in here and mention that this has been a huge challenge, actually, to be running a live study as this disease and as the context is constantly changing. And so what we're finding is that we're spending a lot of time every day rethinking our study, rethinking the symptoms that we ask people about as new information comes in. And this definitely will cause statistical challenges down the line that we really need to think about. And so one of the things that I guess I really want to emphasize is that documentation is key. So every time we make some sort of change in our study, we are making sure that we document it and always getting input from participants in the study, because a lot of folks have made suggestions that we've actually implemented. So I would say this is probably the biggest challenge of my career thus far, running a live study during an ongoing pandemic. But I think we're learning a lot, and this will make our science better today and in the future.
Maybe I could jump in here too, because I think I could branch off what Jesselyn said. As Russ and Jesselyn both said. So I think one thing is that it's key to have open science, as both of them are kind of propagating the message, basically, because the only way that, everyone's in their pockets, in the corners of the world doing this analysis, but we need this data to all come together, which I'm sure Russ and Jesselyn are getting at here too. And by the way, by making all this data available at once together, then we could see the global and how different factors might change over time. And the other factor, like our group, Covert, is doing, we have mathematicians involved, also computer scientists doing machine learning techniques to actually model, what Russ is talking about, Jesselyn talking about. But what we're trying to also do is incorporate the biology to these model risks. So one way to, predict fatality rates is not only a model in, let's say, social distancing rules, or how close and how quickly this virus will spread depending on distance, but we should also consider the different strains of viruses happening and the transmittability of it. So that would come into factor using the bioinformatic data that's there to incorporate into these models to say, okay, if for example, in certain regions we see the virus actually propagating quicker than other places. So why is that? And part of that is because of the biology, then that has to be incorporated in the model, which is one thing we're trying to do also.
To add on that, especially what made this really a very hard forecasting problem, what we had in hand was really a very short time series data, which actually only started from mid-January. So Russ and I, we were actually very anxious to, apply machine learning algorithms to that first, because it's really very easy to overfit. But what we observed during this time, like this was a 4-weekly competition, that the models were really improving, like even with 1 day's data, like getting better and better. Predictive accuracy was improving. Another reason was also we had more time to study and we were learning from each other and collaboration. One thing to keep in mind, like what we were forecasting was really what Johns Hopkins data will report. There were a lot of uncertainty there. For example, one region would get 10,000 more tests, and all of a sudden, the confirmed cases jumped there. Also, the regions changed their policies, how they count fatality, and these are still ongoing problems. Yeah.
Thank you, Brenda.
If I may add really quickly, I think something that can help with addressing the denominator issue is, so a lot of clinical data is now being publicly released, de-identified data. So there are at least 3 resources. So American Heart Association, on their precision medicine platform, they recently released the COVID-19 Research Foundry dataset. And they've also, just yesterday, they've launched a COVID-19 data challenge to sort of encourage people to participate in analyzing that data. So that's an international de-identified clinical data. American Heart Association, they're also putting together a multi-center COVID-19 cardiovascular disease registry, which will have, again, de-identified data and will include biomarkers, cardiovascular outcomes, and other clinical data. And then about a week or so ago, Cerner, they released a news article saying that they are releasing de-identified data to select institutions. So I think as more of this clinical data becomes publicly available, it will certainly help with all the modeling efforts.
So Karan, while we have you, we actually, our second highest rated question from the audience is from Reggie Leonard, from our partner school, the University of Virginia School of Data Science. He's asking something in relation to, I know you're doing work on misinformation surrounding COVID-19. Reggie's question is, what are your thoughts on various media outlets reporting the disproportionate impact of COVID-19 on communities of color? What data should we be collecting going forward to ensure this doesn't continue happening?
Right.
Do you want to get that, Karan?
So, yeah, absolutely. So basically, this sort of ties into my, so this sort of ties into my motivation to why I got into doing this whole literature mining. So around the time while I was doing my research, I came across that on February 28th, WHO and the Chinese CDC, they released this scientific report that sort of summarized the clinical findings from about 56,000 laboratory confirmed cases. So on one of the pages, they had all the details about the clinical symptoms, and they had listed 14 symptoms. And if you recall, initially, all news channels and media outlets, they were only sort of highlighting 4 or 5 symptoms. In that report, they had also clearly indicated that there were asymptomatic infections. This report came out in February, but around that time in the United States, the media, there was still this confusion, this uncertainty around these facts that had already been shown in this large population. So I think part of the, and yeah, that's the challenge, that I feel like any individual who's reading an article, they have their own way of interpreting what's being communicated. And that's why I feel like tools like the PubMed mining tool, and hopefully as all the other clinical data becomes publicly available, we'll have more of these tools. So that way, beyond what's being reported in the news media, these data mining tools can sort of guide the general population on the different patterns in terms of demographics, different racial patterns and so on. So I feel like data science in terms of communicating the correct information has a huge responsibility and a huge role to play.
Thanks, Karan. I think we can all relate to, from the misinformation perspective, your work is much needed. Does anyone else have anything to weigh in on just how data science can help to prevent the spread of misinformation?
Yeah, hey Emilia, Russ again. I want to specifically with regard to breaking down rates with respect to race and people of color. I love that question. I think I sense the data is kind of there, but it hasn't been emphasized. And I know in at least finally in week 5 of the Kaggle competition, we have US data at the county level We do not have actual racial breakdowns per person, but we do have aggregates at each county. And certainly, I think we could tease out some things there based on, say, the proportion of African Americans in a certain county, and we could compare rates and maybe be able to tease some things out. Certainly, it's not an easy problem, and I would not trust any kind of direct media statements, especially maybe the more certain they seem, the higher the probability is that they're probably not right. So a good scientist will almost always hedge what they're saying and put kind of confidence limits or bounds around what they're saying. And that's usually the best approach to take. I actually am interested in that problem, but I haven't looked at it too deeply, and hope to maybe soon, just to see what we can tease out.
Thanks, Russ. Anyone else have anything to weigh in on that?
Yeah, like actually when Russ and we did our analysis, all those machine learning algorithms, at some certain you can explain the variables that are behind those predictions and forecasts. And one of them is those variable importance tables. And from all those models that we trained, we saved those variable importance tables, and we were really looking to find out some like interesting variables to pop up. So far, a lot of the things we see are like more time series variables. Again, I feel like as we have more data and I'm expecting to see more variables, like more interesting variables that we will find out with those models, from those models.
Thank you, Funda.
Mm-hmm.
Maybe I'll jump in really quickly just to add what Funda said. I think and what people have said too, I think part of the issue that happens that the media gets misdirected, as people pointed out, is that some of the data that people are using, not the people here, but that are using, is not fully accurate, or not necessarily accurate, but not fully established yet. So they might be using data that has low statistical power to actually in the machine learning tools, and then the predictions are not going to be as accurate as, let's say, something like that Russ and Karan and Funda are doing here, because they're using larger data sets. So, that's the problem. That's what I think people need to be really careful about. And again, going back to the open science thing, I think the open science, collaborating with as many people, let's say in this group, or other experts who are doing machine learning techniques, is the way to get around that, lack of statistics and the power that some people might be using in their data sets.
Thanks, Afshin. And I think you touched on an important note as well, in terms of just this movement that I think in sort of in the midst of this perilous situation that our whole world is in right now, as a data science community, we've seen this shift in open data and sort of data democratization that I know Russ, Funda, Jesselyn, Karan, you, Terry, you've all spoken about, just the power of collaboration and connection. And it's really been a silver lining, I think. And it's really neat to hear first story from each of you guys. If no one else has anything to add in terms of the misinformation topic, I think we move on to something a little lighter, or maybe a little bit more positive. Our next question, which is, where do you think the most opportunity lies in respect to navigating COVID with data science? And Terry, if it's okay, let's start with you.
I was answering one of the top questions here from one of the gentlemen, Jared, who is an epidemiologist. And he has an absolutely fair point to say that, hey, listen, I mean, data scientists, people with different backgrounds are all jumping in to solve this problem of public health domain, where epidemiology understands how to create predictive models around how do we go around with this disease, looking at these two models. I just answered his question. From a data science perspective, I can answer maybe to the gentleman and also to the rest of the audience from a more practical standpoint, and how we looked at the model that was actually the first, one of the researchers who's working with us is a roboticist. He works at Daimler, Mercedes-Benz. This guy is a control and planning algorithm specialist who's working with autonomous vehicles. And these people were sitting at home, were not allowed to go back, obviously, because we still have a lockdown in Europe, in the Netherlands, and also in Germany. He came up with this a wonderful model he developed, in which I won't go too much into detail, but so there are two models, and I'm sure there are more sort of variations to these models, at least for what I know so far, are the SIR, S-I-R, and S-E-I-R models. So in which, in this model, what we sort of from a data science perspective, we're looking, so we looked at a bunch of sort of how to apply our knowledge to these models, and can we extend these models? And I think that is where, I'm not saying it is something which people haven't done, looking at all the other machine learning models people have been using since the 60s and the 70s, like Markov chain, etc. So we are proposing a discretized epidemiological model that is based on SIR. SIR basically stands for susceptible, infected, or it's actually infective. That's what it is, and recovered. And we are trying to extend it by applying a control input. And a control is where we all as society are actually struggling with. So the control input is basically modeling to the level of social interaction in the population, which is where you see all these wonderful apps with Jesselyn and all these great wonderful people are developing. But how do we try to understand this from looking at the other side of the hill, which is sort of, trying to understand it and not being reactive and saying, how do we do contact tracing and stuff like that? So this modeling, in which we're extending it by using a control input, is to put a level of, so modeling it to the level of social interaction in the population with a delay describing the time between the infection. I'm just reading it because this is what we're writing right now, so I cannot unfortunately share with you guys. And so basically infection at an individual and at the point of time where the infected person has actually registered to the authorities. So then the second interesting point with that very valid question raised by the gentleman makes is, how do you know if you have enough data points? So this is where we are still struggling to understand as to how many people have been tested, right? So when I mentioned in my, I guess, the extended introduction, where we had this resurgence and we are worried about resurgence, what the epidemiologists and also the World Health Organization is saying, you have to test as much and as maximum as you can to be able to bring enough validity to the models that you have. And as data scientists, or as people who try to understand from different perspectives, who have different backgrounds, and try to sort of implement control sort of mechanisms to control or understand how your susceptibles population and how your sort of less susceptible populations are moving, you can sort of then start implementing the interaction and unlocking the interaction when you understand well about these two populations. Today, we have no idea. If you ask me, I live in a city it's about 200 kilometers away from the Netherlands. The only data input that I have is from our, let's say, the CDC, which is called RIVM in the Netherlands. And I look at the map and I say, well, there's not a single death in this little city of 70,000 people. So I think I can do anything. Now that is ridiculous because there could be an asymptomatic person, where it could again restart, and the resurgence could happen in a swimming pool where people come back together because there's not a single death. There's probably not any sort of, there may be just a handful of complaints, people. So I think what I'm trying to get at is we understood this model, and still we took a very conservative approach and not running to the press, which a lot of researchers have done. And I think it's fair to do that. Not every work or paper people have written is peer reviewed. We said, listen, we understand Germany, which is 86 million people. And now we're doing it in Brazil. We're trying to take bigger populations. We just started our work on Canada. And we have researchers around the world. So we're looking at a larger population. Can we generalize these models based on these control mechanisms to be able to provide some kind of this tool that we want to develop, reuniting population tool? Can we give them a very, meaningful advice around, well, that county, looking at the population of susceptibles and the infected people, we think it makes no sense for you to do that. And you would say, well, it's not a densely populated city. But you would say, well, it makes sense not to do that, while, a very sort of, let's say, densely populated city, I cannot unfortunately use the example of New York, but let's say Amsterdam. It's possible to do that. People say, you're crazy, you're opening up these big discos and festivals. But since you understand the ratio of these two populations. So we are not epidemiologists. It's a wonderful field. We were not intending to get into this 2 months ago. But we're just trying to apply this in what we know to improve these models.
Yes, thank you, Terry. And there's so much to be said tonight. So we'll also send out, I'll get with all the speakers and make sure that I know there's a lot of questions also to the audience. You guys have a lot of great questions. And so I'll go ahead and make sure that we record all of the questions and that we disseminate it to the panel of speakers. And so we can get this back to you either way. So we'll try to address every question, whether it's online this evening or whether it's in the future too, if our speakers have time to get to them. Thank you, Terry. And anyone else on, I think we have time for maybe 1 or 2 more questions beyond this. Anyone else on where they think the opportunity lies in respect to navigating COVID-19 with data science?
Emilia, I could jump in again. I think this is just a great opportunity for especially maybe newer data scientists to don't buy what anyone else is saying. Download some data that's of interest to you, relevant maybe to your local area, or like Afshin mentions, maybe you've got expertise in molecular biology, genetics, or like Karan's mentioned, looking at scientific abstracts and publications. Go to the data yourself and form your own conclusions based on all the good principles and things that you've learned. Don't take anyone else's word for it, because the problem is we all have biases and they're going to naturally creep in, but at least if you get closer, the closer you get to the data, the better you're going to know what's really going on. That just seems like that's good advice almost all the time, but especially now.
Can I just add one thing to Russ? Because I think he just nailed it. Because I think part of it is that if you're not an expert in COVID-19, it's okay, jump in, because the out of the box thinking is sometimes what pushes the boundaries to make everyone think of the virus and what it really does, in the biology or the epidemiology or anything else that you look at. So, I full-heartedly agree what Russ had said is, even if you're not an expert, the data's out there. Just go and grab it and think out of the box, and maybe you come up with something that might help, and reach out to anyone here and anyone else who's working on it.
Exactly. Thank you, Afshin. And for the audience and everyone else who will listen to this recording, Afshin's actually really crowdsourcing so many different perspectives and minds and backgrounds to really come together, collaborate, and tackle this COVID-19 situation together. So we'll share Afshin's situation or Afshin's email and background on the project he's working on, and a link to that so that you guys can get involved with him. Anyone else want to speak to our current question on how where the opportunity is in respect to data science on COVID-19?
If you think about it, the opportunities are endless. So from drug discovery to improving the diagnostic tools and pre-screening. So Emory recently released a website where essentially you can enter your symptoms and it tells you, whether you have a high risk of do you have COVID-19, or are your symptoms aligning with the symptoms of COVID-19 or not? I mean, it's not a word of a clinician, but at least it gives you a sense that, okay, I don't need to worry about it, or maybe I should consult with a clinician. And then also in terms of patient care, like once all this clinical data becomes available, I think, and also given the limited amount of resources with respect to, there's been huge ongoing conversation about the ventilators, the N95 masks, and so on. Given the limited amount of resources, if at the time the patient gets admitted to the hospital, based on their current clinical profile, their different biomarkers, laboratory measures, what symptoms they are showing, if by taking advantage of the previous 50,000, 100,000 COVID-19 patients, if we can develop models that can tell us at the time of admission that this patient is on a high risk track of mortality or developing cardiovascular outcome or other adverse outcome, then we can allocate the resources accordingly. So basically, the applications are endless, from treatment to information access.
Thanks, Karan. That's a good answer. So before we enter our lightning round, I think this is a question that's near and dear to everyone's heart right now. How do we see data science playing a role in how we get back to some sense of normalcy? Afshin, you wanna take this one to begin with?
Sure, why not? Yeah, so quick lightning round question. How do we see data science?
Oh, this isn't the lightning round.
Oh, is it? Oh, next is lightning round. Oh, okay, so I'll still be quick to get to it. All right, no, sounds good. Yeah, so there's a couple of things that I think data science can be used to get back to normalcy. Is one, what everyone had discussed today, that, getting the good models that Russ and Funda and Karan are working on, and the projects that Jesselyn is doing also and Terry are doing, that would actually bring us to a point where, we could reopen the society if the models are actually good at what, they're saying. And I think, like Russ and Funda, they're winning the Kaggle competition. So they should most likely, have a really nice model to predict, okay, is it the right time to open society up? And if not, when should we open up? That's the whole point of the modeling, is just to guide the public and the governments to say, maybe we should wait to open up the public till this date. And then, the resurgence that Russ had talked about earlier, when will that happen? So then we should go back into shelter, before that happens to prevent the spread. So that's like one way of using it. Another way of using it is that, that our group's doing too is tackling the big data of the bioinformatics data, basically the omics data, the genomics, the genetics, and all that people are doing massive sequencing projects all around the world, not just us. The UK Biobank just, announced today, you saw in the media probably, they're going to be sequencing already 30,000 patients, and then it's going to be going up to 100,000 patients, soon. So there's going to be a massive sequencing dump happening, and the world can actually eventually tackle that data. And that, and alone, that massive data is the best way for us to come up with drug targets. So as Russ had pointed out earlier, and I agree with them, it's like people who are biologists who could know the biology and tackle that data. There's modeling techniques you can use to actually tackle those omics data to predict if like these certain pathways are being inhibited or activated in the body. Possibly we could use this drug to target the COVID-19 or the combination of drugs. So this is the way that I think that we could push forward really quickly to getting our lives back. And if we don't do it this way, I don't think, there's going back to like, this is purely my opinion, going back to like, screening drugs that exist, I think is a mistake, because some of these, you can't repurpose drugs before we understand the biology, because then, you only sort of effectively and address the problem and not fully address it, because we need to understand the biology first to actually design something to, kill this virus in your body or prevent it from doing it. So that's the key, I think, that the big data is going to tell us, is to understand the biology, to design the optimal drug to actually target it. And also what, we discussed earlier, when we can reopen society based on the models and the current forecasts we have.
Thanks, Afshin. I love that you're continuing to incorporate all the omic data too, because that multi-level data is going to be so critical in solving our COVID-19 situation, and also a lot of cancer, so many other big healthcare struggles that we've been dealing with for decades and centuries. Who else has thoughts on how data science can help us get to some sense of normalcy in COVID-19?
Yeah, Emilia, I'd love to jump in here because I think that this is a really interesting time for us to think about how we can leverage all of the different sources of data that are continuously and passively collected that help us to better understand the movements of people, that help us to better understand what's going on in certain regions and with certain demographics, for example. And so, you know, one of the things that we've been talking about a lot on the college campus is, can we bring students back? And if so, what would that look like? Given that we would have people living in really close quarters, you know, there is, of course, the danger of resurgence, given that people would be traveling from many places and coming together. These are all increasing the risk of resurgence. And so in thinking about some of the passive screening methods, it's obviously not currently an option for us to have, you know, daily or multiple times a day swabbing for COVID-19 infection. But what we can do is think about continuously measuring physiology and behaviors and understanding whether there are these digital biomarkers that indicate that somebody might have early infection. And if we see that starting to crop up in a group of people, perhaps that would be an indicator that we might have a small outbreak here that we need to contain rapidly. And so I think that we really need to get creative with how we start to think about using technology that we already have in our hands to better understand what's going on with the outbreak and what are proxy measures for illness.
Thanks, Jesselyn. Very true. Anyone else have thoughts on resuming to normalcy with the data science?
Yeah, I can add on like how we could, you know, use data science, COVID-19. So there are a lot of different modeling techniques, like, you know, Terry mentioned about epidemiologic modeling. I feel like there is no right or wrong. You know, we really don't have to pick one model and just dedicate and use that. As Russ mentioned, ensembling is really one technique we actually use in our submission too. We follow the fully machine learning approach, and we use like various different data sources and predictions that comes from epidemiological models and combined and smooth out our predictions. So I feel like one advantage of data science and machine learning approach, or disadvantage, that we don't have big data. And with the statistical and epidemiological modeling, it's like also the problem is there are so many uncertainties. So when you fit those models, there are a lot of parameters. So when you make so many assumptions, then you just like easily get from reality too. So we found it really useful to combine more those like data science, machine learning models by combining parametric models. And I think that will be one way to go ahead and do more in the future. Yeah.
Good answer, Funda. Anyone else for this question? All right, so I think we actually have time for one more audience question that I think a few of you can quickly answer for the audience before we jump into our lightning round. The question is, it's from John Hayes. Access to large, well-formed data sets is hard in general. Where do you find suitable recent COVID-19 data?
Oh, hey, Emilia. Kaggle, if you go on the Kaggle website, in the discussion area, there's an entire forum dedicated to sharing of data sets. And I kind of disagree with the actual question. I think there's tons of data out there now. And Afshin's got a boatload, Karan's got a boat, is finding new sources all the time. In fact, to me, it's the opposite problem. You know, which data sets do we focus on now? And we've got more coming from Jess. So data, volume of data is not the problem. It's actually what to do with it. That's always that's always the gotcha.
Thanks, Russ. And John, will, in addition to including all of the speaker and sponsor links that were referenced today, we'll also make sure to get a bundle of, of good links from Russ and the gang, who is very well versed in all of the most reliable data sets that are openly available right now.
I did add a few links in the comment box.
Awesome. Thanks, Karan.
So I added Capital, I added a precision medicine platform, and then also there's this METUS network. They have about 27 different data sets that you can access. So, and this is just a limited, this is not a comprehensive. So as Russ said, there are a lot more sources out there. NCBI GenBank has the sequencing data, and then NextStrain, they have a whole bunch, they have like over 17,000 sequences from all over the world. So there's lots of data out there.
I think
I'm sorry. Go ahead.
The only thing that I just wanted to add was the reliability. Probably, I think that is the question that the gentleman probably may have implicitly mentioned. I think the reliability of data and the data quality is something we are dealing with. So yes, I think we live on GitHub and Kaggle for as much as we can live on those platforms besides our daily lives. But what we realized is when we were looking at even advanced countries like Sweden, you realize that not always you get the data that you need, that you want to fit into the model that you are sort of, let's say, inventing or trying to extend those epidemiological model for, in this case, for instance. I think medical data, as in the images, be it the X-rays or CT scans or ultrasound, I think there you're heavily reliant on the medical institution. We haven't really succeeded in doing that because I think there's a lot of apprehension from medical hospitals all over the world. We are having access to that. But when you look at the text data or the information around, let's say the ratio of ICUs, ICU beds versus the patients in ICUs, susceptibles, et cetera, the quality is one challenge, I think, where you definitely need to know in the sea of data that we have, how do we make sure that the data quality is good? And two, is the data, is fitting into the feature sets that we can apply into the model that we are trying to propose. I think to the other point, to the what one of our wonderful panelists was mentioning, it definitely makes a lot of sense to indeed try strategies to create combination of models, and that's what we are proposing as well. And hopefully, we'll be publishing in the next couple of weeks once we have data of a few countries, and we intend to publish by the end of this month. So hopefully that throws in more light. That's just a little piece I wanted to add.
Thank you, Terry. And you're exactly right. I think that the data sources really even goes back to our earlier conversation about misinformation. And Terry, you'll absolutely have to keep us posted on your research and findings, and we'll certainly send it out to the audience as well and make sure everyone is attuned to that. So are we ready for the lightning round? We've only got a couple minutes left. All right, so for the lightning round, in one line or a few lines, Terry, only one line for you. In one line, what is going to be the most impactful application of data science on COVID-19?
Reuniting the population in the most reliable, safe, and a stable way through which we can resume and unlock our economies.
Awesome, thank you. Who's ready next?
Maybe I could go. It's a tough one. One line is hard, but yeah, basically safely getting out, the data to the communities to actually guide the policies and also guide drug targets to be developed for us to get back to normal.
The forecasts for confirmed cases and fatalities are, to me, are unquestionably having the biggest impact. Every government official that with any sense is looking at those and basing their decisions on what they're going to do with their principality or government or country or region are based on those.
Echoing what Russ said, essentially policy decisions, data science is enabling us to make informed decisions about what to do next as this pandemic evolves.
Yeah, and I agree. I will go around the same thing, like safely and uniform data collection. I think it will help us the most.
Yeah, and I'd say improved access to relevant information which will help with drug discovery, diagnostic or screening, and patient care. And then I'll answer more than one line. I think it's also remarkable if you think about it. Just this symposium that we are having online, maybe 5 years ago, something like this would be a far-fetched idea, but for all of us from different backgrounds to come together and think about a common problem, I feel like that in itself is a remarkable achievement. And we talked about NextRain. I've been following NextRain since February. At that time, they only had 250 genome sequences. We are mid-May. They now have over 17,000 genome sequences. NCBI, GenBank, they only had about 90 genome sequences back in February, and they are also in over 2,000 now. So to think about the amount of work that's been done from different data scientists all over the world, I feel like that in itself, and this goes back to Terry's point, that it is bringing us all together. And I feel like it should not end here. Whatever outcomes, whatever tools, whatever data sets we develop, we should keep these resources and utilize them for if God forbid this happens again, and then we have all these resources in place, so that way we are not starting from step zero. We've already made this progress and we just continue from where we left off.
Thanks, Karan. And I can't really, thank you for closing that out for us. I can't really imagine a better note to end on. So thank you to our thank you to our speakers. Thank you to each of you. We'll surely make sure they get your questions in the instance that they're able to respond, and we'll reach out with any links they referenced in their conversations tonight. And also thank you to our sponsors, AWS, Vertica, and University of Virginia Data Science School. We hope to see you next or week after next at our supply chain panel with IBM, Honeywell, FedEx. Anyways, we've got a good lineup for week after next, and we'll send out information on that too. Other than that, I feel like we need a sequel to this, and maybe we will have a sequel. So thank you to everyone, and there will be a recording too that we'll send out after this as well within the next couple of days, so you can relive this as much as you need to. I know it was a lot of information. All right, have a great evening.
Thank you.
Terry,
Thank you.
I know it's probably 12 in the morning, so thank you.
I know. I'm all charged up. I really mean it, literally. I was like, I was busy with, there's a lot of other things we have to do. Let's not forget, all of us, it's also an economy where a lot of companies are struggling, individuals. So we have to focus on the ball and make sure that we are, able to survive as well, because we're a startup. But now I spent 4 days not writing on the paper, and I know I have to contribute and give my country statistics to our joint research. So I'm like, okay, I could spend the next few hours because this really helped me. So thank you so much. I'm so grateful for this wonderful audience. It's and connecting us to these wonderful people, close to 1,000 people. I can only be grateful. And so it was a two hours great span for me. Thank you very much.
All right, you guys. Thank you, Terry, and thank you, everyone else. We'll see you
you.
soon.
Thank you.
Thank you very much.
Have a good night, Terry.
Thanks.
Take care. Bye-bye, guys. Bye-bye.
Bye.
Bye.
hours great spent for me. Thank you very much.
All right, you guys. Thank you, Terry, and thank you, everyone else. We'll see you soon.
Thank you.
Thank you very much.
Have a good night, Terry.
Thanks.
Take care. Bye-bye, guys. Bye-bye.
Bye.
Bye.
Yeah. Woo!